right. Hello, everyone, again. Welcome to Mental Health Awareness Month. It is a busy, busy month for not only Brain Balance, but also our lovely partners, Mental Health America, particularly San Diego County. We have Brian here today to help represent. I'm going to start off with just a little background about Brain Balance, who we are, why are we talking about this, and why did we invite this amazing partner to share more about mental health first aid. So for those that are joining us, just a reminder, please stay on mute, cameras off. We are recording right now. We will send you a link to the recording afterwards as well. And to please make sure you do your chat in the chat box. I'll help moderate that, okay? So I am Amanda. I am the Regional Director for Brain Balance. We have 3 centers here across San Diego County, in San Diego and Carmel Mountain Ranch specifically, Chula Vista, as well as Encinitas. And we're in the business of helping people feel their best and really perform at their best. We see kids, teens, and adults, usually as young as 3 to my oldest student having been 93. And they, again, have a range of goals and challenges, from things like wanting to improve focus and ADHD symptoms to mental health, particularly anxiety. I see a lot of and have seen a lot of for many years now, to things like anger management, stress management, things like cognition and memory, to learning, and much, much more. So we're quite versatile. What we do is rewire the brain so that you can improve, again, all areas of functioning, whether it's your social skills, to your cognition, to your just overall well-being. And a lot of that research is on our website, brainbalancesandiego.com. If you look under research, you'll get to read a little bit more about how we came up with our program, but also who has backed us up, including Harvard Medical School, to Journal of Mental Health and Clinical Psychology. Again, improving mental health is a huge piece. It's a big reason people come see us. And when you understand kind of baselines for our functioning and what's necessary, it becomes clear why we are so versatile. And this pyramid is an example of what needs to be in place if we are to feel our best and to think our best and to be able to function again in the world as optimally as possible. So again, we really focus on the whole person, the whole brain, building that foundation for functioning so that we can achieve solid quality mental health, I guess, and not struggle, have it impact our functioning and abilities to connect with others. All right. So please stay in touch with us, brainbalancesandiego.com. You can text or call us, and we have a lot of free events each month, including this webinar today. We also have more topics, particularly on anxiety and brain health and healthy aging at quite a few different libraries, San Diego Public Libraries, the rest of this month. So scan that QR code or go to bit.ly/BBSD events, or again, brainbalancesandiego.com. If you scroll down to the events, you'll see what the remaining workshops are available. They're all free, along with, if you have kids, a reading screening at the end of this month as well, as we get ready for summer. Okay. So without further ado, let me stop sharing. I'd like to introduce Brian LaPolla. I might be saying his last name wrong. With Mental Health
Okay.
America. He is amazing. We met actually at a library event when we were doing a workshop on anxiety, and it just seemed like the perfect fit. So I appreciate you running around today, joining us after a full days of training. And I will mute myself. I'll put myself on camera off and let you take it away. All right, and I'll help moderate the chat box.
All right. Thank you so much. I appreciate you, Amanda. And yeah, Amanda's been a great partner for us. I actually was invited to their facility in Chula Vista and had the opportunity to do a lot of their exercises, I guess they're called. I'm not
Yep.
sure what you call
Our
but a lot
activities and
of
exercises, yep.
yeah, and it was really interesting kind of seeing some of my scores for reactions and where my strengths were and where my weaknesses were. So it was really interesting, and I truly believe that their organization is doing great work with the community, and I appreciate them so much. But yeah, with a lot of that said, mental health affects everybody, and it definitely doesn't discriminate. So I'll get started with my introduction. Uh, I am Brian. I am the program manager here at Mental Health of America for San Diego County. And I am the program manager as well as a mental health first aid instructor. So I oversee the program, I do all the scheduling, and then I do trainings as well. I actually joined the organization fairly recently, back in December, so about 5 months now. However, prior to that, I've worked with several nonprofits, working with homeless agencies, as well as oh, thank you, Amanda. I appreciate that. I was working with several homeless agencies, both here in San Diego as well as in Florida. And then I also had the opportunity to work for 2.5 years on the San Diego COVID-19 crisis team when we were in the midst of the pandemic. And with my working with the homeless population, as well as what I saw through the COVID-19 pandemic, both those fields, mental health came up very often. I'm sure, we live here in San Diego County, we definitely see the homeless population, and sure we've seen a lot of mental health challenges, but really it was the COVID-19 experience that really shined a light for me because, that was a traumatic event for all of us, and it really did affect so many people. We were in isolation, lockdowns. We weren't allowed to see our friends and family. There was a lot of fear of what was going on, and that event alone was a traumatic event for so many people, and unfortunately had an effect on a lot of people's mental health. So when I found this position, I thought it was so wonderful because, from what I saw working with the homeless community, as well as being on the crisis team, as well as my own struggles my own personal struggles with mental health, I just thought this was a really great fit. And I'm so honored to have the position that I am in today. And yeah, I love to speak more with you about mental health first aid. What is mental health first aid? So, mental health first aid is the initial help offered to a person developing a mental health or substance use problem or experiencing a mental health crisis. The first aid is given until appropriate treatment and support are received or until the crisis resolves. So, what on earth does that mean? I'm not sure if anybody here is CPR certified or a traditional first aid certified. If you want to raise your hand, if you are CPR or first aid certified, you're more than welcome to let us know or put in chat if you have that certification. But similar to being certified, oh, perfect. I see some people are certified. Excellent. So just like one would get certified in CPR or first aid, we as mental health first aiders, we are the first responders when there is a mental health crisis or a mental health challenge. We are there to assist that person in the beginning stages, walk with that person through their mental health journey, and get them to the professional help that they need. What that looks like is different for every person. When we say professional help, a lot of us do think of doctors or psychiatrists, therapists, but professional help can also be, for example, a school counselor, a trusted teacher, a trusted friend. That can also be a form of assistance that person may need. So we teach people on how to work with those individuals and get them the support that they need. And, similar to being certified in CPR, you're there to do the initial compressions until the EMTs or, the firefighters arrive. And then you kind of tap out and say, all right, the professionals are here. My job is done. We do the same thing as mental health first aiders. We are there to recognize the early signs and symptoms that somebody may be developing a mental health crisis, get them to the professional help, and then continue actually walking with them through the journey as they receive treatment. So what do we learn in our class? So first of all, we talk about the risk factors and warning signs of mental health and substance use disorders. A few of the topics that we do discuss, we go over depression and anxiety. We do talk about suicide as well as non-suicidal self-injury. We discuss psychosis. We talk about bipolar disorder. We talk about schizophrenia. And then we also do talk about substance abuse disorder as well. So I think these slides, by the way, I'm sorry, these slides have a timer on them, so I'm going to be fighting with the PowerPoint slide. I can already tell as these slides are going automatically, so I apologize in advance. But That's what we're going to identify. We're going to talk about several different types of mental health disorders, and we're going to provide the information about those types of disorders so you can recognize what the symptoms are for each one and kind of see the worsening signs as well. Then we're going to also introduce you to our 5-step action plan. This is known as our ALGE action plan. This is the CPR of mental health first aid. And the best part about mental health first aid is that this is an evidence-based program. So there's a lot of research that has gone into all the material that that we teach, and there's been a lot of evidence provided to show that the ALGE action plan does work, and it is effective at providing people treatment through mental health crises. So what is the ALGE action plan? So ALGE stands for, is our 5-letter mnemonic device. We can see here that there's a little koala on our screen. Our program was founded in Australia. So we have our mascot. His name is Algae, and he is a koala. So we've got our koala mascot on screen. And then for our ALGE action plan, we're going to teach people first, we need to assess for risk of suicide or harm. Unfortunately, people with mental health challenges, people with substance use disorders, they are at significantly higher risk of suicide, and they're also significantly higher risk of harming themselves through non-suicidal self-injury. So we're going to talk about how we go and approach that topic. We're also going to teach people how to listen non-judgmentally. I know that sounds like so cheesy and like so obvious, but there's actually a lot that goes into listening non-judgmentally. It has to do with what we say verbally, how we say things verbally. We're going to talk about some things to say that can help the situation, and we're also going to talk about things not to say. And then we're also going to talk about our nonverbal cues. Our nonverbal cues sometimes say more than our verbal cues do. So, you know, if you're pulling one of these, falling asleep in class, listening to one of my trainings or presentations, and you're falling asleep, that to me tells me you're not interested and you're not paying attention. When we give mental health first aid, we want to make sure that we are giving somebody 100% of our attention because that's what they deserve. Then our G, we like to give reassurance and information. This is our hope slide. This is the part of our training where we teach people that we want to give hope for recovery. The state that they're in is not the forever state. There is a new conversation going around mental health, in that recovery is possible. Please note, I'm using the word recovery rather than cured. Somebody may never be cured of their depression. Somebody may never be cured of their schizophrenia. However, it is possible to recover from those disorders and live a happy, healthy, fulfilling life. And part of that is through mental health first aid. Then our last two is E and E. We've got encourage professional help and encourage self-help and other support strategies. This is the part where we guide them to, resources that they may need to reach out to, talk with somebody. Maybe they need a professional support system to work with them. Maybe they need a peer support specialist. Maybe they need to work with a drug and alcohol counselor. But there's a lot that we can do for ourselves and for each other. In our conversation, we talk a lot about self-help and self-care, and it is so important that we teach people how to take care of themselves, but also it's really important for us as mental health first aiders to take care of ourselves, because in order to take care of other people, we need to make sure that we're in a good mental state to take care of ourselves and one another. So we do talk a lot about self-help and self-care in our training. Okay, so why mental health first aid? Well, first of all, mental health problems are extremely common. It is estimated that about 1 in 5 people in any given year will experience a mental health challenge. That is a lot of people. So I think we've got 5 people on this call. So 1 in 5 people in this call will experience a mental health crisis. I will tell you right now that one person for sure is me. I've had my own challenges in the past, so I will self-identify of having had mental health challenges. But you think 20% of the population, that is a lot of people. You're in a room with 100 people, and 20 of those individuals will have a mental health crisis in a given year. That's a lot of people. Unfortunately, there's also a lot of stigma associated with mental health problems. There's a lot of misunderstanding, a lot of things that people may not know or think incorrectly about what mental health is and how to receive mental health. Also, what happens when they do seek mental help. Are they going to call me crazy? Are they going to label me? Are they going to take kids away? These are real questions that people do ask in our trainings and people don't understand. I also like to point out that a lot of this has to do with uh, our trauma. There's a lot of generational trauma. There's a lot of cultural trauma regarding receiving help, regarding to maybe going to doctors. The example I like to use for generational trauma is thinking back to the 60s or the 70s, only 50 years ago or so. Here in the United States, we had mental institutions, insane asylums. These were horrible places where people who were supposed to be receiving treatment got locked away for sometimes for years at a time. And a lot of people saw that and saw what happened, and people just disappeared because they were going to one of these insane asylums. If you saw that back in the 70s, put yourself in that person's shoes. If I saw that, I wouldn't want to get mental health help because of what I saw. And that generational trauma continues with us today. Cultural trauma regarding mental health still continues today. Professional help is also not always on hand. Think about if you ever had a sore throat or, kind of feeling a little fluey and you call your doctor's office and you say, hey, I have a sore throat. When can I get an appointment? And they say, oh, we have an appointment availability three weeks from now. Well, that's not going to help me. I'm sick today. Well, in the field of mental health, it's actually even worse. You may be waiting 2 or even 3 months until you can get a doctor's appointment. So, just the availability of professionals out there, but also think about, if you need to go to a doctor's, it takes a lot of time. It takes time away from work. It costs money. We have copays. If you're on medication, got to pay for that. Maybe you're going to see a nutritionist. Or even worse, what if you don't have insurance? What if you're uninsured? What do you do? What if you don't have a car? How do you get to those appointments? These are all things that we need to take into consideration on why somebody may not get the help that they need. There's a lack of availability. Maybe they don't have the resources to get that. So us as mental health first aiders, we can walk with them through that journey and get them the help that they need. And it's important to understand where we're at here in San Diego with the availability of resources. We definitely need a lot more, and us as mental health first aiders can be one of those resources. And then last but not least, individuals with mental health problems often do not seek help. It is guesstimated that about 40% of people experiencing mental health issues are not going to receive any kind of treatment, whether that is fear of the stigma, maybe they don't understand or know where to go, or again, maybe they don't have the resources available to seek help. So when we have a system where people are not going out to get the help that they need, it's really hard for us to work towards resolving the mental health crisis going on. But us as mental health first aiders, we can kind of destigmatize, talk to people and help them understand what it means to get the help that they need. I talked about a lot of it. This is algae. There's algae. So 4 reasons to become a mental health first aiders. Of course, we want to be prepared. We never know when somebody is going to have a mental health crisis. We don't know who may have a mental health crisis. Some of us may work in the field of mental health. Some of us, maybe has no experience, but you never know when somebody may have a mental health crisis and they may come to you and say, hey, I need the help. It could be a family member. It could be a friend. It could be colleague, that they find that you're a trusted person that they can go to and talk about their mental health challenges. Again, mental health illnesses are extremely common. We can show that we care. There are no legal obligations being associated with mental health first aid. Just because you see somebody with it going through a crisis does not legally entitle you to help a person. However, we never know, again, when a family member may be struggling, or maybe a friend may be struggling. We can be there for that person. Okay. And then, so where do we come in as mental health first aiders? So we can see here, our bread and butter is that early intervention. We can assist with the prevention. We can start noticing those signs and symptoms that something may be awry. Talk about the destigmatization of a lot of mental health challenges out there. But then when early intervention arrives, this is when somebody's really starting to slip into a mental health crisis. We start seeing those worsening signs. For example, maybe we have a colleague who's usually really well dressed and clean shaven, and then all of a sudden we start noticing he's coming in late, or he's starting getting a little scruffy, or perhaps they've worn the same shirt a few days in a row. That may be an indicator that something's going on, and we can step in as a mental health first aider, even just to check in. Hey, I've noticed these things. Is everything okay? Do you need to talk? And you never know what the response may be. That person may say, "Oh, all's good. It's just been a little crazy," or you know what? That person may be struggling with depression. That person may have some sort of schizoaffective disorder. So there's a lot of reasons that this may happen, but we can be there in early intervention, and then we can guide them to the treatment that we need. But of course, just because they start receiving treatment, maybe they're going to see a doctor, maybe they're in therapy, maybe they're going to an AA or NA meeting, that doesn't mean that we're hands off. We can still be with them and support them through that journey. So who were we reaching here? So we can see here that us Californians, we are the most trained of the whole nation for mental health first aiders. And the really amazing part about the mental health first aid training that we have here in San Diego is that our training is actually free. Most places in the United States actually are private trainings, and they can cost up to $150 to $200 depending on what the trainer charges. However, San Diego County has actually recognized the importance of this training, and they are generously sponsoring this training for all San Diegans. So anybody can take this training. There is no charge at all to sign up and take one of our classes. At the end of our class, you will actually receive a certification that is good for 3 years, and it is nationally recognized by the National Council of Wellbeing. So this is not only a national program, but it's actually an international program. It is recognized in 22 different countries around the world, mental health first aid. So you will receive a certificate at the end. You will also receive a mental health first aid training manual, which you can refer to or read up into more details about some of the more nuanced types of mental health disorders out there. But thankfully here in San Diego, our training is free. A lot of people actually like to put the fact that they have their certification on either their portfolio or resume. We work with a lot of businesses like Brain Balance, and I've talked to employers that are actually telling me they're starting to look for these kind of specific trainings. Mental health really came up a lot, especially in the COVID-19 pandemic, about the mental health of the workers. Is it stress? Is it burnout? Or is it something more? So we've actually heard from hiring managers that they see this on people's resumes or people's portfolios. This is actually desirable to them. And we're working with so many companies across the county that are actually training their employees on this training just because they realize how important and how impactful it can be for their staff. So these are the next few slides are just kind of a little generic. I don't know everybody's background on this call, but talking about training employees, like I mentioned, a lot of employers are beginning to look for this kind of specialty training. But it's also very expensive for employers to lose out on productivity due to mental health challenges. Thinking about people taking time off, missed deadlines, missed work, All of this really does add up. And if people actually take mental health first aid to recognize those early signs and symptoms, they can actually assist in preventing a mental health challenging from developing into a crisis. So it's a really excellent way for businesses um, to train their employees. It saves them money, but also if you think about it, if one of your coworkers is going through mental health challenges, you may be taking on some of that additional slack. So it'll also help you because your workload may not be as overwhelming. Thankfully, we also do have some specialty trainings. We offer specialty trainings, let's say for the military. Mental health first aid recognizes the challenges and specific traumas that people in the military have experienced. And so this training specifically it's actually provided by a former Army veteran. His name is Tony. He is our specific trainer for this class. He is a retired Army veteran as well as a former parole officer. So this is an opportunity for veterans to connect with military and their families and it's just nice because they can kind of connect with each other. Like I said, the trauma that military individuals go through is unlike anything else. So there's this training specific just for those people. I also have specific trainings for students who are in college. I'm 36. the what the experience that I have gone through versus somebody who's maybe 19 and first time living on their own is very different. So we actually have a training specifically geared towards college students to talk about a lot of the mental health challenges that a college student may experience and how to work with another peer as well. We also have a public safety course. This is for police officers, parole agents, probation officers. Again, thinking about trauma and the types of things that they've seen, it's really beneficial for people in this field to have a class together to talk about that shared experience, that common background that they all have. I don't think it's here, but we also have a specific training for firefighters and EMTs. Firefighters and EMTs, they witness some really horrific trauma each and every single day responding to those calls. It is not uncommon for an EMT personnel to potentially deal with somebody dying during their call. So there's actually a specific training catered just to first responders as well. Then we have a youth mental health first aid. This training specifically, it's actually for adults who work with youth. Or maybe it's an adult who has a child who they're concerned about, or maybe a niece, a nephew, or a family friend who might be going through some mental health challenges. It's for that adult who wants to step in a child or a teenager's life and assist in making that difference. A little background about mental health first aid. As I mentioned, it did originate in Australia. It was designed back in 2000 by Nurse Jenny and Dr. Kirshner. And the story is that Nurse Jenny, she herself was actually experiencing a lot of mental health challenges. And she went to her friends, family, and colleagues, and she found that the reception talking about it was not quite what she wanted, especially her nurse colleagues. She kind of would have expected more. But there was a lot of stigma around it, a lot of misunderstanding. Granted, think back, this was back in 2000. The conversation around mental health was very different back then. So she sat down with her husband, Dr. Kirshner, and they actually developed this course. It came to the United States in 2008. And here we are in 2024. Again, it's an international program recognized by 22 other countries. And sorry, I got my little kitty cat here. She's being a little needy. I apologize for the distraction. But we also have the Youth Mental Health First Aid Training course, and it is recognized by the Department of Health of Maryland and Missouri and the National Council of Wellbeing. This is our curriculum. So of course, we do talk about, what is mental health first aid. We talk about a lot of the problems here in the United States. We introduce our Algae Action Plan. And then we also move into depression and anxiety. This is also where we discuss suicide and non-suicidal self-injury. Throughout our training, we give trigger warnings. We give encouragement to our participants. If you are ever feeling uneasy, uncomfortable with the topic, please take a few moments to step outside. We also have a little code system for people who may be really feeling triggered through the training that as they may be stepping outside, give a little thumbs down to the trainer. This is going to signify to the trainer that I'm not doing okay and I need to talk with somebody. At that point, we may need to pause the class so we can check in on that person. Or if it's a private training, maybe have a colleague check on that person. We set up a lot of safety measures so that in case people are triggered, they can, take care of themselves. Our goal in mental health first aid training is not to have anybody leave worse than they started. Anyway, after our suicide training, we do talk about psychosis, we talk about schizophrenia, we do discuss bipolar disorder as well. And then we finish up by discussing substance abuse and withdrawals. And it is an evidence-based course. And you should totally take a training. And you can find our training on our website, on our events page. You'll see all the qualis. We host about 20 trainings a month. We do weekend trainings, we do full day trainings, and we do also offer half day trainings. Our trainings are an 8-hour long certification course. So a lot of people find that it's nice to break it up into 2 halves as well. We do offer our training in person as well as via Zoom. So you can take the training from the comfort of your own home. And that's all from me. I appreciate the time. Thank you so much, Amanda, for giving me this opportunity to speak at your event.
Awesome. All right, I'm back.
Yeah.
Let me see. I don't understand all the settings. You think I'd understand technology by now, but sometimes it's a struggle, but I see you. So for those that are on still, I will stop the recording. Give me one moment.